All right, folks, back the final day of SAS Speaker Series here in partnership with Golden Ticket Sports. We are here with my guy, John Chow, is here with us today from Toronto, giving us his time from Myo Detox. He's a registered massage therapist, big time sneakerhead, all around good guy, and doing incredible work here supporting the Asian community in Toronto and surrounding area. I encourage you to give him some love if you're on social. He's going to be talking about prevention of common basketball injuries today, which I know a lot of coaches and those who view this either live or after the fact will get from it. If you have any questions, as always, feel free to throw them into the chat. I'm going to drop some info on John here into the chat, just so you can take a look at his work. A great guy to follow on Instagram here as well, as he's always giving away lots of free little tidbits and info for you here too. So John, I'm going to shut up and get out of the way. I'll let you hit it. And like I said, appreciate you doing this, man. Thank you very much.
Thank you, Tanner. Yeah, so just want to, before we jump into it, just want to say thank you to Golden Ticket Sports, Basketball Saskatchewan, Tanner, of course, for hitting me up and just giving me this opportunity to speak in front of everyone today. I'm super excited. This is gonna be great, and a lot of it is going to be hopefully little gems and maybe more of like education and a different way of thinking after we kind of go through this whole presentation. But very quick background info. Tanner pretty much already covered all the points, but yeah, my name is John. I'm a registered massage therapist. Been practicing for about 5 years already, and I am located in Toronto. And yeah, basketball's been the number one sport for me in a while now. So this is definitely an opportunity that I saw, and I was like, oh wow, this is going to be interesting. So we're going to get into it now. So basically, the rundown of the workshop is as follows. We're going to go through just 4 very simple ideas. Let me know, can you guys actually see the cursor on my screen?
Yeah.
Okay, perfect. Yeah. So yeah, we're going to go through 4 main topics for today: creation, control, capacity. Number 2, most common injuries. Number 3, functional resiliency. Number 4, we're going to give you some exercises to take away. And then at the very end, we'll leave a little bit of time for some Q&A if there are any questions. Cool. So creation, control, capacity. This is essentially the framework that I use. This is my philosophy. This is my bread and butter. This is what I use to tick all the boxes to get an athlete to go from an injury all the way back to
we might have lost you on the sound here, buddy. I don't know, maybe AirPods cut out here or something like that. If anybody else here can't hear John, just drop me a line on the chat.
Can you hear me?
Yeah, Carly can hear. Okay, all good here. Also flip around to my end. Yeah, all good. Okay.
Yeah,
all good, buddy.
Can you hear me?
No worries.
All good? Okay, yeah. Sorry, yeah, so creation, control, capacity. Like I was saying, this is kind of the framework that I use, the philosophy that I basically get an athlete to go from injury to return to sport. Of space. What this really means is for anyone to move efficiently, you always need space in the body. The joints need space, the soft tissue, muscles need space. It's as simple as that. But there are actual restrictions that the body has to go through in order to kind of adapt to the environment. You got some previous injuries, certain muscles are a little bit stiffer than others. And those limitations usually exist in either as muscle tension, fascial tension, or joint tension, right? And all of these essentially act as handcuffs for the body when you're trying to go through shoulder ranges of motion, or just trying to get into like a deeper squat, for example. These are the 3 tensions that usually act on the body and prevent you from moving to your max potential. But the thing that we always have to make sure is that we understand these are preventable, and these are areas of tension that we should be able to pinpoint and ultimately remove. Because if not, the body is always going through something called the path of least resistance. And what that really means is the body is a very interesting thing. It loves keeping you moving at 100%, even when you're not at 100%. What that really means is, I'm sure everyone in this chat, in this room right now, if they've played basketball or if they know a basketball player, they've probably experienced an ankle sprain or something along those lines. But ankle sprains are very, very common. And one of the worst things about ankle sprains are people don't know how to rehab them properly. And when that happens, they always go through what we call the path of least resistance. So take, for example, you sprain your left ankle, you're off it for about a week or a week and a half, and there's a lot of pain on pressure and when you're weight bearing. But the second you start feeling a little more mobile and it's a little less painful to put pressure onto that left ankle, you're going to start walking a little bit more. And then as you're walking, you're probably going to limp and shift your weight to that right side a little bit more. You're still going to baby that left ankle, but as the weeks progress, as the months progress, your left ankle is essentially still trying to catch up to all the pressure and weight that your right ankle has taken in order to kind of compensate and baby that left ankle. So when all is good, left ankle feels good, movement's back, pressure on the left ankle doesn't bother you as much, the body still goes through the path of least resistance. It's always choosing the easiest route to essentially get you moving. So that left ankle injury can almost be looked at as a roadblock, and your compensation kind of moves around it every single time. But once that roadblock, which is your pain, the ability to put pressure on that left ankle is gone, because due to time, you probably stretch it out a little bit, you're still going to go through that that detour, right? It is just until you reprogram how you walk and how the biomechanics should function on that left ankle, innately your brain and your body is always going to go towards that compensation, right? And that's essentially the choice that the body is always trying to create and trying to make for you on your behalf. It may seem like, oh, your body's got your back, your body's trying to help you, but down the line, it's actually going to screw things up a little bit more just because of all the compensatory factors that it creates. So how do we create space? What do we do to remove that roadblock firstly, but also kind of ease a lot of the tension in the body? We use things called manual applications. So as a massage therapist myself, this is my bread and butter. This is basically the mechanical load that we put onto tissues to create tissue adaptation. So this is like deep tissue work, soft tissue work, hands-on massage. But for coaches or athletes do this on themselves, it would be something along the lines like foam rolling, dynamic stretching, using, those new Theraguns, those massage guns that everybody loves? Those are great manual applications to the soft tissue. And the whole idea is like, we want to create as much space in the body to allow for adequate movement, which kind of trickles into the next point, which is control. Control is all about being able to explore your ranges of motion. Control is the idea that we need to be adequate moving in and out of certain positions. Joints, in a nutshell, basically move along a spectrum. So let's take our knee, for example. If you think about your knee and you fully bend your knee, so we're flexing the knee fully, that's one end of the spectrum. And then if you fully straighten your knee, that's the other end of the spectrum. So all joints, no matter what in the body, have this spectrum that kind of goes from one end of the extreme to the other. And if you take that philosophy to any body part, any joint in the body, it all holds true. So The idea is we want to make sure that when we're training or doing drills, or if we're trying to rehab specific injuries, we have to explore the full potential. It can't just be, you know, um, very linear, one dimension. The joints and the body moves three-dimensionally. So every single little crevice of movement that a joint is able to go through, we should be exploring through mobility drills, certain stretches. But at the same time, when we go through certain drills or when we're training, there's too much emphasis on either one end of the spectrum and not so much on the other. So let me explain. Take, for example, you're training an athlete and you're trying to make them super explosive. That's a lot of kind of just living at one end of the spectrum. But the other end is how the tissues absorb that landing and absorb the shock when they're coming back down. So you got a player that's working a lot on like contracting all the muscles and being able to kind of jump up super high to go for that rebound or go for that layup. But we're not spending any energy or any time focusing on how to actually properly absorb that shock when coming back down. So this is just something that I always put emphasis on, because we have to be able to own both ends of the spectrum to make sure that there's no room for error. And through probably like personal experience for myself and just watching athletes play and working with athletes, a lot of times the injuries come on the lengthening of the muscles spectrum. So raw power, contraction, explosiveness, jumping as high as we can, that's usually the main focus that a lot of programs or weight training or even trainers and strength and conditioning coaches like to focus on. But the aspect of being able to absorb that shock while the tissues are lengthening is really the key to prevent a lot of injuries from happening. Because when you're thinking of any muscle tears or muscle sprains or ligament sprains, you're always thinking of how much stress that tissue can hold when you are putting it under load, right? And when those tissues are lengthened, when they're landing, coming back down, if they're not able to kind of withstand some of that stress, it's going to tear. Some of it is going to potentially sublux, or there could be like a joint irritation. So really owning both ends of that spectrum is going to help down the line prevent further injuries. And in terms of control, we always want to look for how the drill can translate into game-like situations, right? We always want to make sure that these drills are scenarios that the athlete is going to actually experience in game, because it's kind of like, take for example, like learning how to drive, right? Like you physically want to be in that car going through situations to help you pass that test. But if you're just kind of watching YouTube videos and you know, doing like a virtual driving game or whatever, and you're not actually in the car experiencing everything as it should be, it's very hard to translate that into real life. So all these control movements, when I'm trying to get them to explore their ranges of motion, it's always going to mimic very similar movements that you do on the court. Which brings me to the next point, capacity. Capacity in a nutshell is just understanding how to use your muscles at those end ranges. So we've created space in the body. We've learned how to control some of the movement, exploring the joint's maximum potential, right? But now how do we actively get ourselves to go into these positions and actually feel safe and strong in those positions, right? So this would be the last part of the 3-step process. I always, create space in the body first, learn how to control certain movements, and then build strength and resiliency around those movements, right? So the whole idea of capacity is essentially when we apply it to joints and muscles and soft tissues, It's basically the ability to endure stress and pressure, right? How much stress, how much pressure can your joints and your muscles withstand before an injury occurs? And this is always going to help maintain your ranges of motion, because if you go through normal mobility drills, say for example, you're trying to, we'll just do like a normal arm circle. We're trying to go through big arm circles, but in the game situation, it's not just you going through, half-assed arm circles. There needs to be a little bit of integrity, and there needs to be a little bit of stability in that joint. So, for example, if you're going through a layup and you're getting contact, someone hits you on the inside of the arm, this joint in your shoulder now needs to learn how to withstand that external pressure coming from this way, as well as being able to kind of adapt and not give up, right? A lot of the restrictions that we go through in life, say you can't fully raise your arm up above your head. It's not always um, a mobility issue. Sometimes it can actually just be the muscles sense threat, and when they sense threat, they involuntarily kind of contract and actually tighten things up, because the body's saying, hey, like, we've never trained in this position. I don't feel comfortable. I feel very vulnerable in this shoulder range of motion. So by default, I'm going to tighten everything up in the shoulder girdle to prevent you from going into that uncomfortable, vulnerable position. If you remember, kind of in the beginning, we're talking about how the body always tries to keep you running at 100%, even when you're not 100%. This is one of those situations where it might actually mess you up a little bit more, because you now won't be able to kind of get into this position if this muscle or this shoulder joint sees that as a threat. So one way that we always like to one, increase the adaptation of the joint, and to lower the threat of being in certain positions, is to maximally load that joint in our max end range. And what that looks like is, if you're going through, we'll just use shoulder flexion just so you can see. So if we're in this position, we want to be able to maybe like hold a 10-pound, 15-pound dumbbell in our hand, and be able to kind of hold that weight while we're in this position. Another way to do it is like, we use isometrics. So isometrics is just the ability to kind of engage the whole area without any movement. So engagement of the muscles around the joint capsule while in that max end range, that's the key to essentially decrease the threat. So now you're telling the body, hey, we're in this position. I know how to control and contract all of this. We're safe, right? Because if you're not training in those end ranges, and for whatever reason you're in a game, and or your athlete goes through like a weird collision, an awkward positioning, they're trying to finish a layup, and they get clipped on the back or the side. That shoulder joint may go into a max end range, and if that shoulder isn't able to safely understand that this range of motion is something that they've been through before, it will tighten to the point where if it's too much, it will tear, or it will sublux or come out of the socket, right? So making sure that you are putting emphasis on end range, maximally contracting the muscles around that area, is going to create that resiliency in the joint, so that you're basically bulletproofing your shoulder, bulletproofing your ankle, and bulletproofing your knees and hips, right? Some of the major joints in the body. And over time, that helps us reprogram the available ranges you have. Now it's not just someone passively stretching your hip or your arm in this direction. You actually know how to recruit the muscles to get yourself into that position, as well as to feel safe and vulnerable in that spot. Perfect. Cool. Any questions or concerns so far?
Nothing so far, John. Really
Cool.
good though, setting the stage here, man. Thanks.
Awesome. All right, so we're gonna get into some more of the common injuries. There's a whole laundry list of stuff that athletes go through, especially basketball players that go through throughout their career. But we're gonna pull up just a few studies that are part of the Journal of Sports Science and Medicine, and these are studies, I believe, out of Brussels. So we're going to go through just some of the more common injuries that athletes actually endure, and then we're going to talk a little bit about it. I'm not going to get too nitty gritty into the anatomy of it. We're just going to very briefly gloss through like how these injuries, like what they look like, what the structures entail, as well as the exercises following up are going to help basically get you to go from injury to return to sport to prevention. So in this chart here, most common injuries in game and practice. This is for men's basketball. We're going to look at the top 3 here. A lot of these are just, the frequency is a little lower, but the top 3 and even 4 are a little bit more common. But if you look at in-game, the ankle, a ligament sprain, the frequency is high. And this is a pretty decent sample size. So we'd say like 26% of athletes within a certain sample size experienced an ankle ligament sprain, which is pretty high. So it's 1,000 frequency. The second one would be like a knee internal derangement. So this could be any like knee tweaks, ACL tweaks, even like in front of the knee discomfort would fall along this category. And then upper leg contusions, that's just like kind of bruises, any like knee to thigh contusions, a little less frequent, but definitely these 2, ankle and knee, as part of the body parts, are the more common injuries that an athlete will go through in basketball. And furthermore, if we look at the ankle and knee, this is basically the absence and how many, like basically the mean number of weeks and days that an athlete would miss due to these specific injuries. So if you look at ankle, absence is around 2 weeks to 5 days. And then if you look at the knee, it's upwards to around 7 weeks and 2 days. So these are large healing times, right? So furthermore, it just proves that like you really want to make sure that your athletes don't endure knee discomfort, knee pain, knee injuries, because they're going to be out for 7 weeks. And as coaches, as healthcare professionals, you always want to make sure that they're able to play throughout the whole season. Usually these are huge setbacks. 8 weeks is a very, very long time to not be able to, practice, go through games. And essentially, if the athlete is trying to hit a certain goal, this will definitely set them back. So furthermore, importance of making sure that you are preventing common injuries, especially in the knee and ankle. Right. So we're gonna get into just some of the more, these are 3 just very, very common injuries. Lateral ankle sprains, patellar tendonitis, we have ACL tear as well. So lateral ankle sprain, usually this is inevitable. A lot of it is actually coming from when someone jumps up and then they land on someone else's foot and then they kind of roll it. That one's a little bit tougher, but with these exercises and drills that I show you, they will just make it so that the capacity for the joint to endure that stress is higher. And what that really means is like you're not gonna be out as long. The sprain won't be as severe, and every ankle sprain basically has 3 grades to it. There's like grade 1, 2, 3. Grade 1 is like a lower end. Grade 3 is like a complete tear of certain ligaments around the ankle. But more commonly, a lateral ankle sprain usually happens when the foot inverts. So a lot of the kind of the front outside ankle gets a lot of the damage. So these ankle drills are going to help just get your capacity up, get your control up, and just create space within that joint to endure a little bit more discomfort. But these ones are hard because they're more of like an external factor. If you get into the patellar tendonitis, this is just a fancy word for essentially jumper's knee. So a lot of players go through jumper's knee. It's funny because a lot of I wish I knew this when I was younger, but a lot of the times when I had patellar tendonitis as a child, a lot of people were like, "Oh, it's just growing pains." It's just brush it off. But if I was actually able to properly diagnose and rehab this, then my knees wouldn't be as shot as they are today. But it's trying to spread that knowledge now. So patellar tendonitis, essentially, it's an overload issue um, whenever there's too much emphasis on contraction. So remember how we were talking about the movement spectrum? There's one spectrum that's like the muscles always contracting and the knee going straight. And then the other end of the spectrum is when the knee bends and the tissues lengthen. Too much emphasis on the contraction side. So jumping, squatting, box jumps, all of that stuff puts too much stress on the patellar tendon. So patellar tendon basically just connects the kneecap to the shin and then the quad to the kneecap. So the tendon gets a little bit inflamed when there's just too much activity. There's multiple factors for why this happens, but a lot of the times it's just an overload of contractile stresses in that knee. So yeah, just making sure that you cover the full spectrum, making sure that you're not just focusing on explosive, from a lengthened position to a contracted position, right? You got to make sure that you're understanding how to do the opposite as well. And then we get into very common as well, ACL tears. The top two are a little bit more, they're not as severe. Patellar tendonitis is actually very common, and it usually resolves once we just do a little bit more strengthening and functional movement, lateral ankle strain as well. But ACL tears, they're tough. You can get tweaks, you can get, partial tears, you can get full ruptures. Oftentimes they require surgery. That's usually the consensus. But I'm the type of individual that always tries to, prevent this from happening as much as we can, as long as they just understand what the mechanism is and how to control the movement and create as much resiliency around that knee joint and the ACL. So ACL, anterior cruciate ligament, essentially, if you think of your tibia, so the shin, and then you have the thigh bone, the ACL prevents the shin from going forward, right? So if you think about basketball, there's so many situations where if the ACL wasn't fully intact or if there's too much stress, that the shin would go forward, right? Many situations like cutting, sharp changes, a lot of start to stop, a lot of like gather steps, hop steps, all of those, there's a lot of shear in that knee. But also the ACL helps with rotational stability, right? So it actually helps kind of create as much stability in the knee joint as possible when we're going through rotation. So same thing, like direction changes, pivot when you're pivoting on your pivot foot, or yeah, just like any like awkward landing, or if you kind of go up for a layup and your foot's in a different position and there's a lot of torque in that knee, the ACL is able to basically keep it together. But if it's too much, it's going to get damaged. So how do we prevent all three of these from occurring? Like what's the major thing outside of creating space, outside of controlling the movement, outside of creating as much resiliency around that joint? What's the one thing that I would preach for preventing injuries like this is something called functional resiliency. Functional resiliency is basically, if you break it up into two, functional is like making sure that the movement mimics real life situations as much as possible. And resiliency is kind of like the capacity aspect, but we want to make sure that you're putting stressors in the joints and muscles that the player will be going through on a very regular basis, right? So functional resiliency is the best segue to go from injury to return to sport and then to injury prevention. So it bridges the gap of rehab and performance. I use a lot of these exercises to essentially help get the joint moving, get the injury under control, and then we'll immediately go into just loading it a lot more and making sure that the performance aspect of that knee joint and that movement is up to par. Loading the soft tissue and movements that athletes will experience again during the game and practice. So like I was saying before, this is the best way to prime the body for whatever it's going to experience, right? So I've spoken to a lot of sports and sorry, not sports, strength and conditioning coaches for certain basketball teams. I've worked with a few in the past, and a lot of their philosophy is kind of just like building raw power in their muscles. So they'll do a lot of open kinetic chain exercises. So these are basically like the equipments that you have in more big box gyms. So leg presses, quad extensions, rowing machines, stuff like that, right? All of that is great. Like, don't get me wrong, you need raw power, you need to build up muscle bulk and strength. But when it comes to injury prevention, there needs to be more emphasis on mimicking what the athlete will actually be going through in the game. So this is more like exercises that when you're standing in a split stance, single leg, even hopping, those are the movements and those are the stresses of the joint, the ligaments, the tissue, the soft tissue, the muscles, all have to go through when you're playing. A majority of the injuries happen during the game, right? So you want to make sure that you set up the environment so that your athlete is experiencing these variabilities so that it's not common to them when they go and play. Like, I don't know, it just doesn't really make sense for me to exercise or load the quadriceps muscle when they're seated or when they're kind of like lying back. You know what I mean? Like in the leg press machine, when they're kind of on their back and the weight is above them and they're pushing it away from them. The stress and even just like gravity playing on the joint when they're standing and jumping is so different. So you really want to try and put a little bit more emphasis on some of that functional resiliency in movements that they go through during practice or in the game. All right. So we're going to get into the exercises. So these exercises are going to touch on the ankle, the knee, and the hip. We didn't talk too much about the hip today, but actually the hip plays a huge, huge role in how much force the ankle and the knee takes on. So if the hip is stiff, if the hip isn't able to kind of rotate and absorb a lot of that stress and a lot of that ground force when you're, running or jumping or rotating, a lot of the power and a lot of the energy stops at the knee or stops at the ankle. And then oftentimes you need it to kind of dissipate all the way through from the foot to the ankle to the knee to the hip. But if the hip isn't doing its job, a lot of times you're going to be putting too much stress on the ankle and the knee. So we're going to have some exercises for the hip as well. But all of these are going to be categorized as a creation of space exercise, a movement control exercise, and a capacity building exercise. So all three of them for each body part. And then we have videos, and I'll explain the exercise as we watch the video. So Our first one for the ankle, we're gonna create some space. So this is basically just ankle drives in multiple directions, right? This is gonna help get that ankle joint and the calf muscle specifically to loosen. We're trying to create as much space in that ankle joint as possible while hitting multiple directions. Basketball is a very multi-dimensional sport. You're not just moving back and forth. You're, your ankle's going through all these different ranges of motion, and you should respect that when you're going through these exercises. So let's take a look at the first one. And then Tanner, let me know if this shows up. We're all good?
Yeah, it's good.
Okay, perfect. So let me just pause here for a sec. So we have a dowel here. Dowel is not necessary. It's just a very good measure and to see how far you can go past it. But I have the dowel right up against my toe. And what we're doing is ankle drives. So you're in a split stance position, same thing, mimicking scenarios that you would be in when you are playing basketball or walking or running. So we're in this position, and then the knee is going to drive inwards. So if you pause here for a sec, you can see the sharp angle that this is happening. This is great for not just the ankle, but you can see it kind of helps increase some of that lengthening on the inside of the knee as well as the hip. So now we're priming that body, giving that joint a little bit of stress going inwards, coming back, and then drive on the outside of the dowel. So now the ankle joint is getting a different stimulus, and the knee is also getting more pressure on the outside. So you would usually do rounds of this, and then you can just drive it straight ahead. This is more just for like calf stretching, but I usually do anywhere between 5 to 8 reps per direction, right? This is super simple. You don't need to really feel too much happening. You do want to make note if you feel any sort of jamming at the front of the ankle versus jamming, jamming in the front of the ankle versus stretch in the back. If you have jamming in the front of the ankle, you probably need to create a little bit more space in that joint in the front. But if you feel like a normal calf stretch while doing this, you're good. You're good to go. Perfect. Yeah, so just driving dowel is just staying in place, and then always trying to just change the direction as much as possible. Perfect. And then from here, we're going to get into the control. So, for control, this is ankle slides in multiple directions. This is understanding how that joint can hold a little bit of weight, nothing crazy, just body weight, and then able to adapt to the weight shift when you're sliding in different directions. And here we're controlling the ankle joint in almost 360. It really doesn't matter which way you slide with the opposite leg, as long as you're able to kind of just go as far as you're comfortable with. So we'll go into that as well. So for this one, the setup is split stance as well. All the weight and pressure is going to be on this front leg. You're going to have a slider. If you want, if you don't have these and you're at the basketball court, just throw a towel down or get them to go in their socks. So shoe on this one, socks on this leg, and then it creates a nice sliding surface. But you're hitting multiple directions as you're sliding. So all the pressure and the weight, you're learning how to control that weight shift when you're going from side to side. And you notice the speed, the directions that I'm going, we're going all different directions. And this is going to prime that ankle joint for changes of direction, weight shift, as well as the knee is able to adapt to a lot of these movements as well. And for this one, you can go across as well. So you can kind of, instead of just sliding back, you can slide behind that right foot. You can go off to the side. You can go in front. You can kind of swoop all the way around and not just kind of return to the neutral position. There's really no wrong way of doing this, as long as that that stationary leg is adapting to the movement. Perfect. Cool. And then the last one is capacity. So this one now is kind of like a progression of the control exercise. You're gonna load. Anytime I talk about load, it's basically just adding more weight to it to basically increase the stress of the ankle joint. So loaded single leg taps. This one is using a kettlebell. And if you don't have weights handy and you want to just run through this before practice, before the game, just get them to hold a basketball. Just even having a little bit of weight shift is all you really need. But you'll notice that same idea, split stance to begin with. All the weight is going to be on this leg, but now we are going through single leg stability. This is going to stress that ankle joint quite a bit, and we're going in all different directions. That foot at the back is just a light tap. We're not putting any weight on it. All the work is done in through here. And this is going to bleed onto the ankle, the knee, the hip, even into the core. So this is super, super crucial. Any direction you see that there's no pattern to it, you just go. The more variability, the better. And you're just trying to let the athlete understand how to properly adapt and control the ankle with the knee, with the hip, right? This is also a great assessment. You can kind of see a lot of weakness being shown into here. My knees are a little shaky, so I probably need to work on this a little bit more, but this is great to build capacity and resiliency in the ankle joint in a very functional way.
And John, just to jump in here, would you recommend this like as a pre-practice, a post-practice? We're telling our athletes to do this at home in their spare time. I guess how often or when should we be fitting this in?
This is great pre. So this is like, I would do all three of these as like a primer for a practice, for a game, whatever you feel like is adequate, that it kind of just gets the body ready for whatever they're about to do, right? So there's no harm in doing this after as well, but I'd rather prime this. I'll use this as a primer so that you're ready in game to prevent any injuries from happening.
Awesome, thanks.
No worries. Any questions or concerns about any of these besides those?
That's great.
Perfect. Okay, so now we're gonna get into the knees. Creating space in the knees. This one is called the step through with toe off. You'll notice that like I don't have names for these. These are, I kind of made them up. So they're just very functional. They mimic situations that you're going to experience. So the creation of space for the knee exercise looks like this. So from here, let me just pull that back. So we're gonna pause right here. So this is the knee that we're working with, and thinking back of the spectrums that we go through, this position is going to be one end of the spectrum. So this is the lengthening. If you think about just the quad, for example, the quad attaches from the hip to the knee and into the shin. So you can see that if you bend the quad that way, you're going to be creating a little bit of length in through that muscle. So this is also going to work on controlling that joint as well. But you're in this position and you're lengthening the muscles around the knee. And then from here, you're going to step. And from here, now you're going into the contractile forces of the muscles around the knee. So the quad is contracting, the knee and the leg is fully straight. When you're going through this exercise, I always prompt the athletes to press that toe hard into the ground, lift that heel as high as you can, because now you're going to get a posterior chain activation as well. So the calves are getting a little bit of a contraction, the hamstrings, and especially the glutes. This is going to help with the less talked about, the less fancy aspect of the spectrum. So more strength through the posterior is going to help the overloading of the front of the body. So less knee patellar tendonitis capability, less knee discomfort in the front as well. So we're going through, you're gonna get a little bit of rotation in the body as well when you're going through this. So rotate, really load and stretch that hip on the side, and then you're going through a full knee extension. And then if you want to, this is really great if you hold a kettlebell in front, or if you hold a basketball, just to kind of get used to going through those motions. Let's let that finish. Perfect. Okay. And then from here, we're getting into capacity. So this one is the hinged kettlebell swings. This is great for building resiliency when you are going through changes of direction. If you ever Google like an athlete driving to the paint, you'll see like their legs are actually, they're doing it with so much, their bodies are basically leaning this way, right? Like there's so much force and so much body sway into one direction that they actually put a lot of stress on the sides of their knee. So with this, it's going to help a lot with those sharp cuts, those crossovers when the knee has to push off, changes of direction, even just rotation. So this one is great for all of those. And you need a kettlebell with this as well. This one's a little bit tougher to do with just a basketball because you really rely on the weight shift of that kettlebell. But if you see here, as I'm swinging, there's a lot of, even when you do this, you can try this later on your own. When you do this, you feel this inside work a lot to stabilize your knee from buckling. And then when you swing it off to the other side, there's a lot of pressure in here as well. So this is going to basically cover both the lateral sides, but at the same time, the hip, the knee, the ankle, they're all working together. But more importantly, this is going to help kind of bulletproof that knee from any ligament strain. And we're just swinging side to side. There's no real rep count. There's no magic number. If you want, just 10 swings, 5 on each side, just to kind of prime everything. But you'll see the foot is being challenged as well, the balance, and there's not a lot of weight on that back leg. All of the weight is in the front here. Perfect. And then getting into the hip. Hip, like I was saying before, super crucial for ACL, super crucial for ankle sprains and knee resiliency. You want to make sure that the hip is able to absorb a lot of that ground force reaction. So every time you kind of land on the court, or every time you're running, or that foot is slapping the ground, you want to make sure that that hip is able to absorb a lot of that force, but at the same time being able to kind of rotate smoothly through any range of motion. So for creating space, very textbook hip flexor stretch. You've probably seen this before, but I spice it up just a little bit because you're going to get more three-dimensional approach, and you're going to hit different muscle fibers as you go through this. So setup is something soft, just so your knee's not getting crushed on the ground. You're going to be in a kind of a lunge position. Front knee is in the front leg is bent. First thing you want to do is go through like a posterior pelvic tilt. If you don't know what that means, it's basically just like squeezing your glute on this side will kind of tuck your pelvis in a more favorable position. And then from here, I always add an arm reach. What this does is it essentially gets your stomach fascia or the muscles around here lengthened, and it elevates your rib a little bit as well. This is great for breathing. This is great for mobility in the torso. And then from here, you'll notice my foot positioning. So this one is straight back. When you go through this, you're going to get just a very straight muscle fiber stretch. So this is kind of just going through the front here. And at the same time, I always add a little bit of a curve. So I'll reach up and then I'll bend over towards the leading knee. And then as you progress, you hold it for a few seconds. It feels really good in the front. Then you're going to change it up. So now I'm internally rotating my leg. So my foot is actually on the outside of my knee now. You're going to get more lateral hip stretch. Same protocol, same principle everywhere else. Squeeze the glute, reach up, and then bend over. Only thing that changes is that direction of the ankle. Then you're going to go inwards. Now this is going to get more of the inner. You'll kind of get a little bit of the adductors, the inner thigh muscles, as well as the muscle fibers on the inside. And then same protocol. You're reaching up, and then you're bending over to get that stretch. And then also, if you want, you can do all of these all over again, but now you're going to add a rotation into it. So I like same setup, arm reaching up, but this arm on the side now is going to reach back. So you pause here, you're going to get a nice anterior sling stretch. So hip flexor to the abdominals to the opposite pec. This is a huge stretch for the upper body. Right, so reset, reach up, and swing back. So that's the hip flexor stretch. That's just to create some space into the hip joint. Second one is going to be control. So Cossack squats in all different directions. Like I was saying before, this is going to touch on the ankle, the knee, and the hip all together. But more importantly, this is going to just allow you to experience changes of direction, experience the hip being stretched in different orientations, as well as getting the joint to experience different movements. So the Cossack squat in different directions looks like this. We get into, oops, sorry, let's go back. So start with kind of shoulder width apart, feet together, and then you're going to step and lean towards the leading leg. What this does, it's almost like two birds, one stone kind of situation. This is the hip that's actually getting stretched, but at the same time, you know that initial push off and land on this leg, you're actually also helping the knee and the ankle absorb that shock. So you're getting both ends of the spectrum here, but on different legs. So that's getting a nice stretch. We're going just across, but now we're going to go in front. So pause here. This knee is experiencing a different stimulus. This hip is getting stretched into a different orientation. The direction has changed as well. And this is all going to basically just open up, control that max end range in all different positions for that hip joint. And then we go backwards and you get a nice hamstring calf stretch with that as well. But you want to make sure that you're controlling this motion just as much as you're controlling that stretch in the back. Right, so it's kind of a two for one, which is super beneficial. And then, yeah, you can even go straight in front. Like it doesn't have to be those orientations. You can even make it a lot tighter. So kind of like the clock orientation, you can go like 1, 2, 3, 4, 5, 6, all semicircle all around. Whatever you feel is more beneficial. And in terms of repetitions, no magic number here as well. You can basically just do every number of the clock as one rep, or you could just do the orientation that I'm showing here as well. And then lastly, we're going to get into the capacity. So this one's one of my favorites, touches on a lot of aspects of functional resiliency. But the main thing is that it mimics movement, mimics in-game movement very well. So it's called the loaded hip hinge with rotation to knee. If someone can come up with better names for me, because this is like, it's very literal. We're going to get into this exercise here. So you'll notice very similar to the knee toe off, but kettlebell is loaded and we're really getting into rotation. So that hip is maximally loaded. When you're in this position, kind of like a deadlift position. So it's more like a hip hinge rather than a lunge. So your level change doesn't happen too much. Your glute muscle should feel a huge stretch in through here. And then what we're going to do is, this is working a little bit more on the explosiveness. So the end of the spectrum that everybody focuses a lot of, you're going to, step back, good, and then launch and knee drive. So now this is working on getting your glute in the back to lengthen, but also driving your hip into flexion. So this is a move that a lot of players need stability, need strength. They need to be solid, because this is essentially like when you take off for a left-handed layup, or if you want to switch the legs, it would be like a right-handed layup. You need to be very, very solid in air to be able to kind of absorb any contact. So we'll replay it again. You just kind of go through the reset. So you hinge and then watch the feet here. So this leg that's doing a lot of the work is also the one that's going to drive up the knee. So it's a quick switch in the feet. So load, and then from here, launch. So very functional. This movement helps with, layups, jumping, getting that hip to really, really feel that load in the back. Let's play it one more time. Good. So we're loading it, and then step, and then knee drive. So load, step, knee drive. Good. So from here, you really want to push this as high as you can. You should feel a lot of contraction in the front of the hip. And that is it. Yeah, that's kind of the whole common ways, philosophy of thinking, ways that I like to prevent some of the injuries. Obviously, there's only so many exercises that I can show in this presentation without taking up a full hour. But yeah, I'm going to open up to any questions. But before that, I just want to say thank you so much for joining me today and listening. And another big shout out to Tanner and the Golden Ticket Sports for giving me the opportunity to speak in front of everyone today.
Awesome, John. Thank you very much, buddy. I appreciate that. And
No worries.
has been fantastic. Like you said, following you just on Instagram, I feel like I'm stealing every morning here, and it's certainly helped my routine even as well. So hitting you
Awesome.
right off the hop here with questions from our attendees. Do you recommend a specific amount of hours for one doing exercises like this on a per week? I'm sure there's some individuality to it. Or do you recommend a specific number of hours for practicing basketball per week, per day, all of those kind of things? Is there any hard and fast rules that you go by, John?
Yeah, so very, very case to case specific. A lot of the times it just really depends on I think the goal of the athlete themselves. So if they're training for something, if they're playing very regularly, like more than once a week, twice a week, I would actually try to emphasize as much time allocated to these pre-game. So anywhere, like, it doesn't have to be very extensive. You can allot 30 minutes upwards to an hour before the game. And that's like, if you're very, very, very diligent with this, that's one situation. Not everybody has that time. nor do a lot of athletes put a lot of emphasis on pre-game routines and pre-game stretches or mobility drills. But in an A1 situation, yeah, like if you can do this daily for a couple of weeks, just to kind of prime the body, get yourself into a routine, that's amazing. But those daily movements, they don't have to be extensive. They don't have to be like an hour long. Even just doing this for 10, 15 minutes every day, you're going to see results, and you're going to see just like overall better efficiency in movement. But yeah, daily like 15 minutes is ideal. And then if you can, 30 minutes upwards to an hour before a game is perfect.
Awesome. Okay, next one for you. Could you just go back to the control exercises for the knee again?
Yep. Oh, did I skip this? Oh, no, I didn't. I said this, right?
Either way, we'll get it again, my man.
Yeah. Yeah, so what we're doing here is all the stress is put onto this front leg, and then we're rotating in front. So from here, we're maximally rotating. This is going to help with a lot of the ACL rotational stability that we were talking about. I think I skipped this. My apologies. This is going to put a lot of emphasis on external rotation when we rotate through. So this leg stays completely stationary, and you're rotating this back leg back and forth. So you'll notice that the leg drives first. Let me play that again. So the leg drives first, and then at the very end, pay attention to the hip. The hip finishes the movement. So that hip movement is going to, one, increase some space on the hip as well, but also maximally put this knee into rotation. A lot of people will feel hesitant doing this just because it feels like almost your knee's going to give out, but work your way towards it. You don't have to step so far in front to begin with. If you want, you can kind of go a little off to the side first, and then just kind of get your body used to it, and then continue as you go through. But if you kind of look in through here as well, this still stays stationary. The hip moves all the way back, and then this knee is now going through internal rotation. So we're kind of going back and forth, back and forth.
Fantastic. Okay, last one for you, John. What are
Yeah.
your thoughts around visual engagement techniques while performing stretching or mobility exercises?
I think they're super, super beneficial, because a lot of the times it's just like, it's another way to prime your body, right? Because it is a very visual game as well. And I think are you alluding to like a lot of like the sensory exercises that I see a lot of people doing nowadays, where it's like a lot of lights, and they'll use those as like prompts? Or are you talking more like visually watching someone go through something? But either way, visual is a huge component, because it basically is a way to prime the brain to understand how to go through certain movements. It's just like watching film, right? Like that's one of the best ways to learn how to move properly in through game-like situations. Yeah, so huge fan of that stuff.
Awesome, John. I can't thank you enough, buddy. I know that you put a ton of time into this and crafted it here, especially for the topic that we threw at you. So really appreciate it, man. We'll give you the last words here, and folks will get this replay up shortly. John, once again, man, thanks very much.
Thank you, guys. And yeah, just hit me up if you have any questions or concerns. But this was great. Thank you.
Perfect. Thanks, everybody. We'll be back in about 25 minutes with Coach Steve Burrows from the University of Regina. Thanks for tuning in.